Good afternoon. Thank you all for joining today's press briefing. Today, the North Dakota Department of Health confirmed 2 additional cases of novel coronavirus disease or COVID-19. One was in Burleigh County, one was in Walsh County. In Burleigh, it was a woman in her 30s who had close contact with another positive case. In Walsh County, it was a male in his 70s, and that one is still under contact tracing investigation. Just got a update as I was walking in the room. We had questions yesterday about the 300 tests that were done in Cass County that were sent to the Quest lab. A batch of 30 of those just came back at 3:58, and one of those is positive from North Dakota. We do not have the county to report on that yet because that just came in. So that would bring us to 3 additional cases versus the 2 that I just said a second ago. North Dakota totals, 1440, that's plus 85 from yesterday, and 32 now positive, 33 with the one that was just texted in but not part of the data that's reported yet here. 4 of those hospitalized, which is a 0 increase from yesterday. We've now received tests from 48 of the 53 counties in North Dakota. Couple comments on the low testing. The 85 individuals from yesterday, we expect that some of the low testing results may have been just, people on a weekend. As often, a lot of medical activity slows down on weekends. There may be people that just weren't going in, but there were places to get tested over the weekend, obviously, and I'm certain that there'll be more tests that are being done today. We would expect that to go up. There's no delay right now at the state lab. The state lab is all set up and has no shortage of materials at the state lab. We are investigating some reports of some supplies around the state that might be missing from a collection site, including swabs and others, but we've got a team that are tracking down every one of those things because we believe that within the state there are enough materials in the state for people to continue testing against the criteria that we've described earlier. And again, one of those things that we do want to make sure in the testing we've talked about is that people who have been in contact with someone who's been positive, if you've traveled to a place that's in a hot zone, that might be, again, a risk factor. If you are a medical worker, and I want to broaden that definition of medical workers to include first responders, because again, people that are working on the rural ambulance service, whatever happens to be, we want to make sure that those individuals, if they think they've been in contact with a positive case or they may be showing symptoms, we want to get those folks tested right away so we can either isolate them or keep them in the workforce, one of the two. So again, they're encouraging people that fit the criteria to get testing, but again, it is up to your medical provider. Again, call before you show up, and when you and then work with your own medical provider to see if you fit the criteria. But again, we're making sure that the supplies exist for all of our medical providers to do the testing that they want to do. We are one of the states that is fortunate to, for the 3rd day in a row, have a relatively low increase in cases. This is not the situation in the rest of the United States, and it's not the situation in the rest of the world, and I would not want anyone to become complacent to somehow think that North Dakota is geographically immune to this virus or this pandemic. The global cases now just in the United States are over 42,000 cases in the United States. That's up by over 6,000 from yesterday. Deaths in the U.S. had their biggest single increase yet, 266 people in the United States dying from COVID-19 yesterday, bringing deaths to 577. And globally, the global number of deaths over 16,000, with the global number of deaths yesterday being 1,746. And so this is, again, not the time for us to be complacent. Each day we have a day like this gives us one more day to prepare. And when we think about what we're trying to accomplish. The strategy we've talked about in all of these conferences is that we're trying to flatten the curve. By flattening the curve, you're not necessarily shrinking the area under the curve, which means that we may end up with the same number of people who contract the infection and the same number of people who get seriously ill from the infection. But if we do that over a longer spread of time, then we're not going to overwhelm our medical resources like we're seeing happening in other states like New York right now, where they've had just an explosion of cases and their medical system is becoming overwhelmed. So that is that's what we're trying to accomplish. The other thing that we talked about yesterday was upping our efforts on contact tracing. When we think about the work we're doing to maintain physical distance from each other, again, that 6 feet or more is one of the ways to think about stopping the spread is the maintaining physical distance. And I'm saying that in the affirmative of maintaining physical distance. I think there's some confusion when we're using the word social distancing. Social distancing doesn't means physical distancing. And in a world where we can connect by phone and Skype and FaceTime and all kinds of video conferencing, the way you can the postal system's still working, you can write letters and stay in touch with people. We're encouraging people to stay socially connected as much as you can. That's great for your mental health. It's a way to rebuild relationships. It's a way to, when you're working remotely, lots of fun things that I know are happening that are creative people in this world that are coming up with that you can do with your to maintain social contact. But we're talking about keeping physical distance with social, with all the ways we can keep social contacting. But again, not the time to be complacent. But what this is that each day that we have a low count here gives North Dakota and North Dakotans another chance to prepare. We're in a logistical battle right now. The task force that we talked about over the weekend is starting to gain some traction in terms of how we're planning with our medical facilities to make sure we've got the things that we need. That means, do we have enough beds? Do we have enough key equipment, including ventilators and personal protective equipment? And do we have enough staff? Those are the three components that we're trying to track to make sure, because we might be weeks away from when we would have a crunch on our medical capacity. But today is each day that we get a chance today to do more planning and more work and more preparation. That's life-saving days on days. So we're grateful for days like today. And again, we know that the measures that we've taken in our state are causing hardship for people. We know that that's the case from around the country, but again, we're likely benefiting from all of that already, and from what other states have done and what the nation has done to reduce the amount of contact between people. With the contact tracing, the strategy on contact tracing is that we're not just celebrating negatives, we're trying to find the positives. Because instead of asking everyone, healthy or not healthy, to stay at home, which closes down our economy, the more targeted approach is if we can actually work hard to identify the positives and then find out the people who the positives have been in contact with. And if we can do that in a deeper, stronger, better way than any other state, then we can be really focused on our isolation approaches. So, again, if you know someone who's tested positive and you've had close contact with them, you should be self-isolating. You also could report in to our Department of Health. If you've traveled, you can go to the website for the Department of Health and report and be part of that self-monitoring. We set a goal yesterday. We're going to try to get a 10x increase. We've had a good first day on that. We're now up to 123 people that have been trained to do contact tracing, 25 are Department of Health staff, 98 from local public health, 16 NDSU students that are going to be coming online soon. So we're getting started on that. We've talked to some of the private sector medical system presidents in the state of North Dakota. They're going to have some people that are continuing to do that. But we want to make sure that, we have these low numbers. We find somebody who's positive. If we can find the 10 or 20 people they might have been in contact with and work through that group, then this can be more effective in what we're doing. So again, you know, if you're waiting for your test to come back, if you thought you were sick enough that you needed a test, then you should be self-isolating, and so should any of your family members. And of course, washing your hands, keeping this safe distance away is the best way to go to help spread. And of course, again, if you're going to go to a clinic to get tested, please call ahead. The next topic I want to talk about for a minute is child care. We said yesterday that we'd be providing more guidance today on child care. We know that if we're going to have a potential crunch in the weeks ahead to provide medical services for people that may become critically ill in numbers that stretch our capacity, if we're going to be doing that, we've got to make sure that child care is one of the essential pieces of infrastructure we need to be able to do that. And we've talked about the numbers before, 1,800 providers in our state, 44,000 students in that K through pre-K age group that utilize those systems today. We also have students that are below the age of 12 that are in our K-12 system. That would be people in kindergarten through approximately 5th or 6th grade. When you throw those things in, we have 132,000 of the citizens in North Dakota are under the age of 12, and that's a wonderful, wonderful thing. But 71% of the kids that are age 0 to 5 have all their parents in the workforce, and the labor force participation rises to 78% of kids that are in that 6 to 12 age group. So we know that there's been a big impact on child care with people suddenly finding themselves out of work because of the decline in oil prices. That was the thing that was hitting us in the last couple of weeks. So as we were having unemployment increases there, people are at home, they may be pulling their kids out of child care. So we've had reports of some child care providers who've seen a drop in their census count. That hurts their economics and creates challenges for them. And again, the child care sector in North Dakota is essentially a private sector solution. On the flip side, we know with the schools closing, then some of our child care centers have been reporting, hey, we've got a bunch of parents that, normally in the summer we would take kids that would be elementary school age during the summer, but we don't take them during the school year because they're in school. And now parents are saying, hey, can we drop off our kids that are in 1st through 5th grade? So others are seeing increase in pressure in terms of more capacity. The healthcare providers have all been calling us and saying, hey, we're concerned about child care for our workers. Should we be working to try to set up, temporary solutions? We would like to not set up temporary solutions. Child care is a federally regulated activity. To work in a child care center, you've got to be gone through a federal background check, which includes fingerprinting. You've got to go through licensing, which we administer here at the state. We care utmost about the safety of our children, and so we have no plans on relaxing the requirements to either work at or become licensed to do a child care. That's why we don't want to create a bunch of pop-up or alternative systems. We want to support those child care organizations, many of which are small businesses. We want to support them as they get through this. About 10% of those 1,800 have already closed. Many more have limited their service so far. What we're announcing today is a rapid planning process. It started over the weekend. We've identified 3 objectives from this planning that we're doing. One is provide child care for essential worker households. Number 2 is protect the health, children, and families of child care workers. And then 3 is importantly, we want to sustain the child care sector as an industry that's essential to every business in our economy. If you think about it as sort of $1 million a day business in aggregate, it's about a $365 million aggregate business in the state of North Dakota that is again, severely challenged right now. So how are we going to do that? The planning process that we're going to look at is going to look at a couple of things. To improve and protect the health of the children and the people that work there, we're going to be putting together some modified operating practices. Those modified operating practices may include things like changing the ratio of the number of child care workers to the children. And that would have, if you're going to have increased distancing among kids or have them spread between more physical rooms to create that distancing, you're going to need more workers. Most organizations at a time when they're having a decline in their census count would be laying off child care workers. We're going to be likely heading towards a set of rules which will require them to have more workers. And so if we do that, then we believe that there may be a role and responsibility to consider financial support coming from the state for that. So part of this planning exercise is can consider different financial support mechanisms that may support those organizations that stay open and are prioritizing the work for essential workers. So we're going to, over the next few days, and that'll include Chris Jones, who's going to be up here in a moment, who leads our human services, and Jessica Thomason, who's leading the whole child care services area within our human services area. Those two will be leading the charge, and they're going to work with stakeholders to help develop these modified guidelines that for all child care providers that would follow during the state of emergency. And also we are going to be working on defining a list of essential worker households for the purpose of prioritizing child care. We can do that, and for a starting point, we're going to be using as a starting point the essential worker guidelines that are being provided by the Department of Defense. And we'll be working to implement a system that's going to help create, again, the right kind of financial incentives to help people do what we need to do during this emergency, but make sure that they continue operating and are able to ramp back up when we come out the other side of that. The plan is that this rapid planning process that we're going to go through, which I say has already started, will take input. We had an opportunity to visit with our legislative leaders this afternoon, and that planning will go on. We'll announce final guidelines no later than 4 p.m. on Thursday, with the idea that implementation would occur next Monday. In the meantime, the guidance for child care operators today is we just say thank you. We say thank you to you and to all the people that are working in those child care locations for continuing to stay open and stay operating during these challenging times. And thank you to all the parents that have been supporting as customers of those organizations. We hope to make sure that we can keep this to be a vital and healthy part of our economy when we come out of the backside of this crisis. So again, I know this is a stressful time, but we encourage and applaud all those child care providers for staying open, because we know they're providing an essential service, and again, so we say thanks to them. Next up, I'm going to invite Chris Jones, who leads our Department of Human Services. He's going to give an update on human services and programs administered. We've talked, Human Services is the largest agency in the state of North Dakota, with over 2,000 team members and a biennial budget of over $4 billion. And we've talked about a number of those things, including behavioral and mental health in the past. Child care services, of course, is a component of what they manage. They manage so many other things that touch the lives of almost every North Dakotan, but we're going to get, that whole team has been working really hard through this whole emergency, and Chris has been doing a fantastic job leading them, and Chris is going to give us an update on a number of things that are going on in human services. Chris?
Thank you, Governor. Just wanted to go through a number of things that are going on in the Department of Human Services. Like the Governor said, it is a large state agency. Our primary goal is to serve North Dakotans either experiencing poverty or vulnerability, and want to make sure everyone is aware of what's going on. Before I go through a couple of key items, I would direct everyone to the DHS website, where there is a COVID box that you can click on that has all of the FAQs as they come available. And many of these FAQs now are being driven by the federal government, because we are waiting for guidance on many of these things. Many of the things we could have done at the state level, we already have. But within the Department of Human Services, we have the Human Service Centers, and wanted to let everyone know those remain open. We continue to provide services. We do restrict visitors. We do restrict visitors in terms of into our crisis units, and we do pre-screening, but all services in the regional Human Service Centers remain open. Similarly to the state hospital, we are still open. We have restricted visitors entirely, but we are not refusing any admissions. As far as the Life Skills and Transition Center in Grafton, again, we are not restricting admissions or reducing admissions, but we are restricting visitors, and we have limited some of our community-based programs through there. As the Governor mentioned, we do have the Behavioral Health Division. There is resources on that website. specifically related to COVID, but would also encourage parents to go to Parents Lead to find resources on how to talk to your children about what is going on, but also how to work as a family as what's going on in general language. It can be very helpful. One of the bigger divisions within the Department of Human Services is Medicaid. As of, I believe, Monday of last week, the federal government released the 1135 waiver guidance, which released some of the things that are related to what we can do in Medicaid and what we can't do. Those became least restrictive in terms of a number of different services. We have a number of different things we have applied for through that waiver. That was applied for Friday of last week, and we expect some feedback back from CMS shortly. Additionally, in collaboration with the Department of Insurance, we have relaxed many of the telehealth rules, specifically related to telephonic visiting. Human service zones. This is formerly known as County Social Services. One of the large redesigns that happened over the last session was moving from 53 counties to 19 human service zones. It is an amalgamation and sometimes just a mashing together of how we work together. That is another 1,000 they're county employees, but they're really administered and paid for by the state, and we've been working closely with the counties to ensure that they remain open. So what that means is many counties have closed their offices, but we are working with them for the counties to allow those employees to bring their computers to work from home or set up appointments. We've also done a fair amount of work to provide more electronic access to the eligibility programs online. So we believe that everyone's able to continue to work. And most importantly, we know that child protection services, foster care services are continuing to be delivered across the state through the zones. Economic assistance, it used to be a requirement. We had to do face-to-face interviews for a number of the programs. We no longer have to do face-to-face interviews for SNAP, TANF, LIHEAP, any of those programs. Additionally, somewhat related to the child care plan, our child care assistance program used to be required the number of kids that were actually in the child care. Now the payment is based on enrollment. So given the volatility of what's going on in child care, the child care providers can expect a more stable payment. In terms of children and family services, we've also been working closely with the courts. I think Chief Justice Jensen mentioned this yesterday, but working with them to maintain the normalcy that we can for kids in the foster care system and in the judicial system. And then within the aging services and developmental disabilities division, it's another part of Medicaid, but we are working on an Appendix K to reduce some of the regulations as it relates to serving those individuals across the state. So there's been a lot of work that's been going on across the state through the Department of Human Services. We know there's still more that we can do, but many of the things we feel right now are going to be a function of many of the stimulus packages that come out of Congress over the next coming weeks. So thank you.
Thank you, Chris. Next up, we're going to have Superintendent Baesler give an update on a few items related to K-12.
Thank you, Governor, and thank you, everyone, for being here today. I'd like to begin by making an announcement, and I realized as I was about to make this announcement that there's been a word that's been used frequently over the last 10 days that is very, very common to my K-12 arena, but it's very different in the way that it's being used. So I'm going to try and keep this very clear. I'm making an announcement today about tests, and they are not the COVID-19 tests, but they're very much more germane to my area, and that would be student tests. And so I'm going to try to use the word assessments as we do that for lack of, to eliminate any confusion. But when I say assessments, I'm saying what most of you remember as student tests from your days in high school, elementary, and college. So today, in partnership with the governor, I want to let everyone know that I've requested a waiver for North Dakota from all federally mandated student assessments for the remainder of this school year. We cannot let the burden of federal assessments detract from the hard work that is occurring developing learning systems that support student learning during this unprecedented time. We have canceled the North Dakota state assessments that are normally given each spring for English, mathematics, and science. We have also canceled the ACT makeup tests, or assessments. Most of our North Dakota 11th graders have already taken the ACT exam on March 3rd, but those who weren't able to do the March 11th date will receive a voucher from the state to make up that assessment in June or July. These assessments play a significant role in measuring a school's quality and their accountability, and this decision was not taken lightly. Removing 1 year of testing sounds like an easy, simple fix in these times, but waiving student assessments eliminates important data that is used to strategically allocate significant financial and human resources throughout our state's schools. Teachers and schools have worked hard all year to ensure students are learning the required elements, and they will continue to do so. But we have determined that testing this year under these circumstances would not only yield unreliable data, but would also place a heavy psychological burden on students and teachers. By waiving these state assessment requirements, teachers and administrators will be able to focus on the pressing and important needs of students and families. That is why we're asking for the federal assessment waiver for this spring. We understand that losing a year's worth of information about students' progress is not ideal, but we also believe that pressing ahead would be disruptive and would not yield reliable information. Since this virus event began, much time and energy has been spent on what we fondly and technically call at the department big people issues, and we say that with air quotes. And while these conversations are very critically important, our mission at DPI remains focused on serving our state's students, their families, and supporting our teachers and school leaders so student learning can continue. We continue to work with our school districts to develop distance learning plans, and we're working in partnership with the governor's office to get those plans reviewed and approved as quickly as possible. But a call this weekend with my family engagement cabinet reminded me there are very important questions and issues to attend to also and to answer. So I want to now reiterate how important our families are in this learning partnership. But I also want to assure our families that you don't have to become experts at teaching reading, math, or science. The Family Cabinet has committed to working to bring helpful academic resources to all North Dakota families, but it doesn't need to be complicated. One Family Cabinet member put it best. She said, "It's about books, about spending time reading to your child or having them read to you. Take a nature walk, encourage them to be curious, or help them learn fractions as you make dinner together." All of our young people need routine, because with routine comes security in these uncertain times. What families can provide as children's first and most influential teachers is a sense of calm, security, and routine. You can develop simple schedules, and a sense of routine will occur. With that, I would like to share with you an important and exciting family engagement program available for our youngest learners and their families. This is an exclusive opportunity for North Dakota and 4 other states in the Upper Great Plains: Montana, South Dakota, Idaho, and Wyoming. Right now, we have 280 children registered for this program that begins this fall in 2020. And we will be able to register as many 500 children from rural communities in North Dakota. It's a simple, fun, and age-appropriate way to bring our families together with our youngest learners, and a program that you can do at home with your child. Because of North Dakota's selection, this program costs nothing. And if you do not have a computer or internet access, that will also be provided at no cost. This is a way to truly empower our families for our youngest learners. To participate, the child needs only to be 4 years old by August 1st, 2020. Parents just need to go to waterfordupstart.org to sign up, or you can go to DPI COVID-19 FAQ webpage as well. It only takes about 8 minutes to register. During this extended isolation, it has caused us to connect in new and different ways. And I am grateful to have the continued advice and guidance from my superintendent student cabinet, the family cabinet, our teachers, and the educational leaders through these challenging times. In the past few weeks, I've been thinking a lot about Mr. Rogers. And in fact, this weekend, about 10 days ago, when we were in Unified Command, I made a comment, "Where is Mr. Rogers when you need him?" I really wish he were still around to talk to our young people about how to deal with all that is going on, just as he did after 9/11. So I want to close today by sharing a quote from Mr. Rogers that I think is particularly appropriate. He said, "All of us, at some time or another, need help. Whether we're giving or receiving help, each of us has something valuable to bring to this world. That's one of the things that connects us as neighbors. In our own way, each one of us is a giver and a receiver. And anyone who does anything to help a child in his or her life is a hero." So my gratitude to all of those heroes out there helping our children find their way through this, and deep gratitude to my partners at the state government. Thank you.
Thank you, Superintendent. And thank you, Chris. As you can see, we got great leaders working hard across health and education to keep the important aspects and the services of government rolling as we go through this emergency. A couple of comments before we go to on some other topics before we go to Q&A. The first one is we had a conversation with the North Dakota Grocers Association. Their distribution and manufacturing partners working overtime to meet demand, and this demand is interesting, because part of the demand isn't that suddenly Americans are eating a lot more. People are just upping their home inventory of food and supplies, and so that's happening. And of course, we think it's appropriate. People should be to have your shelves stocked, but we continue to hear odd stories and get pictures sent to us about everything from toilet paper to whatever running out. And they wanted us to assure everybody that all toilet paper in America is made in either Canada or the United States. So any rumors online that supply chain disruptions from other countries have interrupted that, we can be confident that that's going to be here for us. Also, again, we want to echo this idea from the Grocery Association, is that shop responsibly in the sense that even for those grocers, if they're are challenged. I know that there was one local that here we saw that, I think it was Walmart's advertising, trying to hire 500 people to work here just in the Bismarck area in distribution and store stocking of shelves. And again, we'd ask people to keep going to the trusted sources of information, whether that's ndresponse.com, North Dakota Department of Health, many of the fine media outlets we have here that are reporting on this. But hoarding supplies can take supplies away from vulnerable people that may really need it, and we just want to assure people there is going to be enough for everyone if we all shop responsibly. There was another, so that's that topic. Next one is on unemployment count. We've been giving out, sharing these counts. Wednesday, I think I shared the data a week ago. We were at 80 a day. 400 in the week prior. Last Wednesday, we had 600 people apply for unemployment benefits. Thursday, 1,600. Friday, 2,600. Over the weekend, new record, 2,224 requests came in over the weekend, and through 3 p.m. today, 1,048. There is a question that we got that came in about waiving 7-day delay in benefits starting. We're working related to our IT systems to see if the waiving can be done. That could be difficult to do that. Through the executive order, we streamlined the application process. We expanded eligibility. We sped up administrative procedures, but right now there still is 7 days between approval and when the checks start coming. So we're working on that to see if we can shrink that up, a systems and people issue. But again, we also, Lieutenant Governor and myself have been advocating strongly with our federal federal partners, our congressional delegation, to make sure that we've got one of the ways that the federal government can move money to this nation right now is making sure that the existing unemployment system in insurance is fully backed up, and they've got the ability to even change some of the ratios or reimbursements there. So that could be a great mechanism for helping to support those that are affected by this emergency. Another question that we got about earlier today, we did report over the weekend that we'd moved 7,100 folks out of state government to be working from home, and that requires capability at all levels. You got to have your right kind of desktop, you got to have the right software, after whatever, but you also have to have the connectivity, and that connectivity for some of the confidential work that's being done by the state of North Dakota is not just done over the open internet, it's done over what be considered a VPN or a virtual private network, and that includes making sure that we've got enough bandwidth from the telecom providers, it's the CenturyLink, the Verizons, and those to do that. And we did this morning, when we came up with a record number of people working from home, we did have for a short period of time, about 45 minutes this morning, we had people that were unable to connect. As I said earlier today, when you are doing new things, you stress systems, and so we pressure tested our ability to go from very few people working at home to over 7,000. So kudos to the team that got all that done, and all the elected officials and cabinet leaders that helped their teams do that. But we did have an internal IP address saturation for 45 minutes. Easy fix was expanding the number of IP addresses and working with our telecom providers. So that's fixed. But again, as I've said, when you've got this kind of disruption, it creates an opportunity for innovation. We're innovating, and we're also learning how to make our system stronger and better to help us in the future. So that was something that was resolved. In closing, before remarks, I think one of the things that we want to just say as we're heading into springtime here. When I was leaving the Capitol late on one of these nights over the weekends, and I could hear the geese flying by. You know, dark sky, couldn't quite spot them right away, but you're like, hey, spring is coming to North Dakota. And spring has always been a time of optimism for people in our state. We've got, farmers that are out there in spite of everything they went through last fall with fall flooding. Some of them are itching to get in the field this spring. And we're going to have, more longer days, more sunshine. I guess the day is actually technically the same. It's the amount of sunshine that we'll have will be increasing. So we'll have more sunshine each day through June, and anyway, I just say there's reason to be optimistic, but part of it is we're optimistic because with the way we've seen the people in our state willing to collaborate and willing to work together, these extra days with low counts have given us a few more days to do our planning, and that's all positive. But I would just invite all, whether you're parents at home or people that are working in essential services, or if you're on the front line taking care of people who've been stricken by this new and uncertain virus, for people to do two things. One is to keep the courage up, because that's always been a hallmark of people in our state. And the second, of course, is just kindness. Be kind to yourself and be kind to others. We need that now more than ever. And it's very kind of you to keep coming to these press briefings every single day. We know that working just as hard as government is the folks in the media. So thank you for being here today, and we'll open it up to questions. Yes.
I have a question for Superintendent Baesler about canceling ACT state tests. How does this affect students who are now applying to colleges?
So the question was canceling the ACT tests. How does this impact students that are applying for colleges? So there were, just to be clear, the statewide testing was March 3rd. So that's when the vast majority of our 11th graders took the test. That is the test that the state pays for. There were earlier tests. There were tests in January, and there were tests earlier in this school year, in the fall of the school year. So what we have done is we had two school-wide makeup tests tests that we're going to be delivered or administered in the end of March. We've canceled those, and we will now be providing vouchers for them to go to the ACT administered test, and they can choose a site at their convenience that they could get to using one of those vouchers. So with that being said, we are working with, there's a couple state scholarships that have an ACT criteria, and so we're working with the governor's office on including an executive order to make sure that that scholarship deadline aligns with the opportunity for those students who weren't able to take it March 3rd and or through their senior year to be able to take it in the June and July exams as well.
Just a follow-up on that. You said vouchers. Where's the money coming from?
So the vouchers, we will actually be receiving the vouchers from the ACT, so we will coordinate. But several years ago, the state legislature, when they created the North Dakota Scholarship and the North Dakota CTE Scholarship, the legislature appropriated dollars to the Department of Public Instruction to ensure that every 11th grader in the state of North Dakota was able to take the ACT exam and or the Work Keys ACT. And so it's actually a state law that every 11th grader be required to take that exam at this point.
Have there been any confirmed cases of COVID-19 in nursing homes or assisted living facilities, and are you confident that the measures being taken by those facilities will work in preventing the spread amongst this vulnerable population?
Two-part question. First one was, have there been any confirmed cases in North Dakota in nursing homes? And number two is, am I confident the steps that were been taken, are they enough? The first piece on that is, I would say we're not releasing any information on other than gender, age, and county, so we'll continue to stick to that from here. If there were to be a case in a nursing home, I'm confident that that facility would notify everybody in the facility and their family members, and all of you would know about that. But in terms of what we're doing right here, we're gonna stick with that. In terms of your second part of your question, is it enough? This goes back to what I said about contact tracing, which is we have tried to put controls in place to reduce visitation, be extra cautious about the people that are working in our 80 skilled nursing centers around the state, to make sure that no one is reporting to work who's either been sick, traveled to a hotspot, or has been in contact with someone who's tested positive or is living with someone. And I know that puts workforce challenges on them, but so far, we haven't had an outbreak. People here, familiar with Kirkland, Washington, but buried under the news of what's going on in New York, there have been multiple other states that have had serious outbreaks in skilled nursing centers, and so it continues to be a grave concern of ours and everybody that's involved in this fight. I mean, because we in North Dakota have the highest percentage of people as a percentage of our population living in skilled nursing centers of anywhere in the country, and we have long lifespans in North Dakota. We have a lot of folks that are 65 and older in our state. So this is why the keeping physical distance as a way to reduce the spread really matters when you're talking about grandparents and great grandparents or anybody entering in or out of those facilities. But again, if you can't go visit them and it's lonely business. If you know someone who's been in a skilled nursing facility, sometimes it can be a lonely spot. The bright spot of the week is when the grandkids come. This is a tough time if those visits aren't happening. So this is a chance to go that extra mile to, write a personal card, give them a phone call, make a gift, do something like that to make sure that we're supporting those that we're trying to protect.
Governor Burgum, you referenced all the nice weather that we are having this week. What sort of guidance would you give to people who are wanting to go outside and use our parks and our trails?
Question from Amy Bismarck Tribune was that I had referenced all the nice weather we're having, and what guidance would I give about parks and trails? This is not an airborne spread disease. I mean, it's spread through the droplets that come when people, sneeze and cough, and those can carry a distance of 6 feet. So if you're out on trails, great. keep your distance away from other folks. People have, other governors have said, we want people to get outside, walk your dog, go for a walk, do that. They don't want to see a pickup game of 20 people playing basketball in a park, where unless your defense is really lousy and you're more than 6 feet away from everybody. But it's we would try to find activities where you can keep your physical distance. I mean, sometimes I know there's groups that meet and do outdoor exercise, out on the front lawn of the Capitol, and I see these folks outside our window when we're working sometimes, and there were some groups out there with an organized some organized personal trainer class, but they were all keeping a strong distance away from each other. I mean, that's like fantastic. People are still getting out, they're getting exercise, they're just keeping that distance. So again, I think that's the key. And of course, same thing, if you think that you've had exposure or to someone or around that's, in a case, then, stay away from other people and don't ask someone who's a vulnerable individual to go for a walk with you and be right next to them, because we're trying to avoid that kind of contact. But fresh air is good for everybody. Yes.
Okay, quick question. A viewer called into our station wondering about the sort of backlog with the Quest Diagnostics testing from out east in the state. Wondering if you could just touch on that once again and let us know if there's anything that can be done to speed that up.
Question was about the backlog of the 300 tests we reported yesterday from Quest, and I got an update on that just before this. As I said earlier in the comments, 30 of those have come back today, one of those positive. That was right at 4 o'clock. We don't know the county or the gender of that, but it is a North Dakota case. So that would mean there's 270 that are not reported. What that health system has done, well, they've been waiting for the tests to come back from Quest. They've done two things. One is, as of yesterday, they've stood up their own testing. And so now they're no longer sending tests to Quest. They're doing them through their own walk-up, drive-through testing. So they'll be able to give their own 24-hour turnaround. Over the next week, those ones that were held up, that were supposed to be done in 3 days, but turned into 7 or 8 days, those will be coming in perhaps in 30 to 40 a day. I guess that would get you, 7 days would get you to the 300. They have, of course, contacted all those people. So the 270 whose tests have not come back, they've reached out to all those people. They're all isolating at home. None of them have been hospitalized. Many of them are recovering and their symptoms are getting better. And so for some of them have already been in 7 days of isolation or more, depending on when they first took their test. So they're managing that population and asking those people to isolate until they get a confirmation that they're negative. Thank you.
There's been a lot of talk at the federal level of a stimulus package. In your mind, what would be the most productive way to distribute federal dollars to the state?
Well, it turns out there's about as many ideas about how to distribute somebody else's money as there are dollars. I mean, so again, what you're seeing in that bill, which I hope will come out of Congress, I guess it failed on a vote again this afternoon. Hopefully in the next few days they'll come together on agreements, but it is a potpourri of different options. Two of the favorites that Lieutenant Governor and I believe is a smart way to deliver money quickly and effectively. One is through unemployment insurance and shoring up that whole system, and then perhaps changing the benefit ratios. Instead of paying somebody 75% of their pay, maybe you're paying 100% of their pay through that unemployment. That would help support the economy in terms of maintaining incomes and maintaining people's ability to pay their mortgages and maintain consumer demand and all the things that would help support our economy come back quickly. The other one we've talked about is block grants. There's complete uniformity. All 50 governors in the National Governors Association, regardless of party, believe that if you had block grants, meaning if the government, instead of the federal government sitting around and arguing over all the policy approaches on how to spend $1 trillion, send out a check to states, and then states could figure out where they need it, because each state's needs are going to be different. Each state's needs might have different efficiencies in terms of how we're able, how efficiently and effectively we're able to put that in the hands of people and make it work. Because each state's got a different economy and different geography and different aspects of rural and whatever. So it's very difficult. Federal programs, very difficult. Our nation, when you count all the territories that are covered under the federal, you're talking about 14 time zones and enormous complexity, and it's very rare that a federal program can ever have a one-size-fits-all approach. So that's why and again, people forget the states created the federal government, not the other way around. If we've got this ability to drive dollars, give them to the states, and I think you're seeing around the country, governors are leading, and it's smart to give money to the states. So those are two things that we would encourage. Now, we did push over the weekend, and it turns out that of the $1 trillion being discussed, there is 10 billion, or 1%. It would be 1% of $1 trillion is 10 billion. That would be included in state block grants. 1% probably wasn't the number that the 50 governors were looking for out of $1 trillion stimulus bill. We would thought that would be higher than 1% of that would show up in block grants. But it's a start, and I'm likely, given the depth of what seems like we're heading into, if you call this STIM 3, there'll likely be an economic package that the federal government works on that would follow this, which would be, call it STIM 4. But maybe in that one, they can shorten the debate and have more of it be state block grants.
Speak to what the current ratio is in North Dakota that's required between child care workers and children?
I'm not sure I understand the question.
We're talking about potentially changing the ratio.
The ratios.
Of child care workers. Yeah.
Okay. So the question was about the ratios of number of workers to children, and that's exactly what we're going to be working on the planning process this week. So we have some ideas. We're going to run them by the child care providers and try to understand what's the right target that we should get to that would achieve the physical distance we want to have, but ensure the safety of the kids and the safety of the workers. But that'll be part of Thursday's announcement. They have a set of guidelines that they have to operate under now to be a licensed operator, and the direction that we're contemplating is that we would actually require more child care workers per child. So you'd have a increased distance, but you'd have a higher ratio, if you will, sort of think of it as a teacher-student ratio, child care worker to child in child care. We'd be, lowering, increasing the number of child care workers, increasing the number of that per number of students. That's the direction we're evaluating.
Do you know what the current guidelines are?
I don't off the top of my head, but I know people that do know them, and so we're those are probably available online, right? On the.
I mean, I could give you a couple.
Come on up here, Chris.
So a couple of those guidelines as it relates today for infants, it's one teacher per 4 children. And as you go up, they increase. And as you get to the school-age children, it's one teacher per 18. And then there's gradations in between all of those. So if you think about the 18, we would likely go down to 1 to 9, 1 to 10. But we will work with the stakeholders on what's the best ratio for the situation.
There were only 85 tests performed, I guess, in the last 24 hours. Would you expect that number of tests to go back up this week?
Question was, there was only 85 done yesterday, Sunday, for COVID tests. Would we expect that number to go up? And I would say yes, I would expect that number to be higher today. We got a question coming in online.
So Eric Arndt, KZZY in Devil's Lake, asks, given testing is a lagging indicator, how concerned are you about a jump in positive tests in the coming weeks or days?
So Eric Arndt from Devil's Lake, thanks for listening in, and thanks for the question. The question is, how concerned are we about potential jump in positives in the weeks ahead? I'd say that we remain as concerned as we were before, which is, my bigger worry is that when we have days when we only have 2 positives, then everybody's like, oh, well, got nothing to worry about. We're different in North Dakota. I would just encourage people to look at the growth in cases in every other state and understand that we are not different than other states. We're not, we may be the last in terms of the timeline of when we get it, which is a very fortunate thing, but the infection rate based on contact is not going to be different. It's not like we've got any special immunities here in North Dakota that are going to prevent us from having the same kind of results as anybody else. This is, you can't, this is not a time to say, wow, it's different on the two coasts in our country and we're special here. We know we're special, but we're not special when it comes in terms to immunities to this virus. And so we have to continue to look at other states' data, and that's why we're continuing to plan with a great sense of urgency to make sure that we're doing the things we talked about, which is we want to raise that line in terms of the available hospital capacity to make sure that we've got enough beds, that we've got enough equipment in terms of ventilators and personal protective equipment, and then we got enough staff. And having enough staff means we got to have the child care piece figured out. So we've got days here we can keep doing planning. And the other part we're doing is to try to slow the spread, is continuing to encourage people to maintain those good hygiene, wash your hands, and keep physical distance. So we're able to work both sides of that thing longer than some other folks have. We're literally getting more time to solve the problem than New York did. And the state of Washington, had the problem before they even identified what it was. I mean, they had, 27 deaths in one nursing home before it was even fully identified what they were dealing with. We are just very fortunate here because I remind people that could have happened here if one traveler had arrived here that was positive and was a super spreader. We could have had the same thing here. We just didn't. So again, we're grateful to not be in that situation. So we remain highly, highly vigilant. I would also say that from talking to some people in the medical community, everybody's working and trying to develop models and predictive models of where we might be. And I would say that, some of those models, if you've looked at some of those models, we should continue to keep moving with real urgency on the path that we're on to make sure that we're both increasing hospital capacity and getting the word out about physical distance.
Is there a way to access where the positive tests are per county? Is that something online?
Question was, is there a way to access where the tests are, positive tests by county? Is it online? And the answer is affirmative, yes. And then I'm going to ask people, is that on Department of Health? Okay. healthnd.gov. Any other questions? One more online.
Renee Jean with the Williston Herald asks if there's any updated information on what models are showing for bed capacity in North Dakota.
Any updated question coming in from the Williston Herald? Are there any updated models showing bed capacity? That's what the task force is working on right now. I mean, we know how many licensed beds are there in North Dakota today. We've got the licensed bed number. What the task force is working on is try to make sure how many of those could become available and how many extra capacity we could create. I'm sure people have heard online about other states rushing to put together field hospitals, Army hospitals, ship hospitals, temporary hospital capability. What we're trying to work here is trying to figure out, how do we expand? Some of the medical providers that we have here in our state have got wings that are currently being unused that could be brought back online. In Dickinson, we've got an entire building because a new facility was built. The old building was used in just like 2 years ago, could be converted back into a hospital. So we're going to continue to look at existing physical infrastructure that was already previously involved in healthcare, because if it was previously involved in healthcare, then it may have the kinds of infrastructure like an oxygen line to the room and things like that would be useful. Then the second wave after that is if we have to start going to other facilities like university dorms, we would do that before we would start setting up what, literally like sort of what you might see in other places, like trying to create a hospital out of a convention center. We've got options here in North Dakota, I think, that would be superior and quicker to that. But that's part of what the task force is doing, is can we raise the line of available beds? Okay, no other questions? Any other ones online? Radio legend Dave Thompson, no more questions? Okay. All right. We have a radio, yeah, okay, we'll keep it secular here. Okay, so we have but anyway, thank you all for being here. Mike, are we on for 4 o'clock tomorrow? Is that the plan? Okay, well, we'll see you at 4 o'clock tomorrow. Thank you all, and stay healthy.